This government meeting is brought to you by Eastworks and our local cable subscribers.
Okay. Welcome everybody to the February 7th Commission on Disability meeting. I'm glad that all of you are here. I appreciate it. So I think the first thing we're going to do is we have somebody that applied to be on our commission new, so we're going to go around and introduce ourselves. So do you want to start?
I am Jeff Brown. I'm an Easthampton resident, council member, and a commission member. And I'm also a staff at Riverside of the Streets.
Wow.
Yeah.
You want to go next?
Yeah. I'm probably Jeff now.
Yeah. I'll put me out.
Yep.
Yeah.
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 Do you want to go?
I'm Bryce. I'm also from Riverside. Yeah. Good.
Welcome
Oh,
back, Bryce.
Hi, I'm Eli Damon. I'm the vice chair of the commission. And we lost the owl somehow. I'm working on that.
Angelique Baker, the chair.
I'm Liz Puff. I'm the community social worker for Easthampton. I work downstairs.
I'm David, of Riverside.
My name is Christopher Frappier, and I work for the Center for Development and Civic Engagement at the VA.
I'm Nancy DeRocco. I'm the new applicant here.
I'm Chuck Duffy. I'm the head of the DAV volunteer drivers up in Leeds.
Good. And I'm Mary Morris. I'm the secretary on the commission.
Thank you, guys. Not up and running yet, right?
Right.
So we're just gonna hold on for 1 minute. See if we can get it.
Okay. Oh, that's microphone, video. Oh, okay. Meeting owl.
Oh, there we go.
No, there we don't go. Let me go get it again.
Excuse me, Chris, can you spell your last name, please?
FRAPIER.
FRAPIER.
Translation.
Yep.
No.
So I'm gonna hold off on the speaker for a minute because we want to make sure that the people at home can see the speaker, because sometimes we have a member that joins us via hybrid. So in terms of minutes, did anybody see anything wrong or missing from last month's minutes if you were here? 10, 11.
I don't know why I read that.
What?
If everybody's okay with the minutes, then we're gonna vote them in right now.
Yeah.
Motion made to accept minutes.
That's weird.
Okay.
All in favor for the minutes that were here? Thank you, guys. Let's see, what else do we want to do that might not be recorded? None of it. Well, we could talk about the school tour. Do you want to talk about it?
Okay. So Eli and Angela met with, I could already forget her name, this lovely lady.
It's okay.
Something.
Yeah, it's okay.
And the
Go ahead.
liaison between the town and the school.
Yeah.
Is that right?
Oh, there it is.
Yes.
And,
Yeah.
Oh, that was one thing.
she
Sorry.
brought us around the new
Thank you.
school. And it was lovely, really. So it's a very nice school, and she was very open for our questions, and that's kind of it.
Yeah. So
Is there anything that struck you from like an accessibility perspective, or what they did for students with disabilities, or?
Didn't feel that. Yeah. I mean, there was a lot of, for the kids without disabilities, mobile disabilities, there was a lot of running up and down stairs, but they did have it kind of delineated so that each, like the one grade would have one floor, but they did have to come down for feeding. But they had an elevator, which we went on, and that was fine. And, we did look in the bathrooms. We weren't 100% sure what we were looking for, so I'm not sure how hard. And once I forget it.
So we didn't have the list, the long list of all the things that are wrong with the school, right? So, and even if we did, we're not trained to see that, so.
Do we know if they've addressed any of them?
She would not have known. The woman doesn't know anything about that. I mean, she did feel like we were there to find things that were wrong, and I just said that we don't. We didn't have the list, so there was nothing. Yeah.
Where did that list come from?
The things come from.
Yeah, they have
back to our minutes, but,
yeah, the two people that came in. Do you remember we had speakers maybe that were sitting down that way?
Yeah. Okay. Yep.
And their job to find things that are wrong. So I've asked for access for that list. I don't know if we'd be able to even read it. I don't know if it's in like different type of speak than we're used to. They're like codes, right? Because it's code issues.
Yes.
So like we might not understand it at all.
Right.
yeah, there were several code issues really pertaining to
Is Dan not there? You're right, Stan. Keeps forgetting.
No, I don't think so.
Okay.
It's here.
No.
One thing that struck me when I was there, I've been there several times separately, and there a few times a week, but
Right.
basketball practice. But let's see, in the lower grades classroom, they have some sensory friendly seating there that just is ingrained in every classroom that I don't think existed at the other schools, or at least wasn't as prominent. And there is a quiet area attached to each classroom,
Right.
which is nice. In Maple, at least, was just a section of the room that probably wasn't noise blocking at all, and so that is nice. And the breakaway rooms for specials right at the end of each hall, which is nice. It's not, students could wouldn't have to necessarily travel.
For the purposes of recording, if we could just project our voices a little more, because I'm having a hard time hearing the both of you, and I'm right here, so you guys are very quiet. Still no stand?
Still no stand.
Okay, all right, so we can revisit that, but we have a speaker, so, from the VA. So take it away, go ahead.
All right. Well, hi, thank you for having me. So, Angelique wanted me to speak about the different services that we have at the VA. And so, just to give you a little backdrop of our facility, and then also the facilities that encompass our healthcare system. So we are the Central Western Mass, and we have our main medical center campus in Leeds.
Hold on 1 second, you are not on camera, can you scoot down this way?
He is on the owl.
He's not on that one, and that's
Okay.
the other one,
Okay,
so.
let me just make sure that my bald spot is on the side.
Got it.
So, okay, and so we are VA Central Western Mass, so we have our main medical center at Leeds, and then we have community-based outpatient clinics in Springfield, Fitchburg, Greenfield, Pittsfield, and Worcester. We just built a brand new multi-specialty community-based out clinic in partnership with UMass Worcester on their campus, and that is now up and running. So all of our services that we offer at the VA are for all veterans, whether they have a disability or they don't have a disability. And then depending on their service-connected rating depends on the type of care that they can have access at the facility. But some of the services that our healthcare system offers are primary care, which includes geriatrics, pharmacy, a primary care team, and women's veterans care. Then we have various specialty cares that happens at our medical center and then at the different outpatient sites. And that's audiology and speech pathology, blind and low vision rehab, COVID-19 vaccines, cardiology, dental, dermatology, diabetic care, infectious disease, laboratory and pathology. We have a MOVE weight management program, neurology, nutrition, food and dietary care, ophthalmology and optometry, orthopedics, physical medicine and rehabilitation, PT, OT, and KT, which is kinesiology, therapy, podiatry, pulmonary medicine, radiation oncology, which is more of not the actual radiation itself, but the pre-radiation care and the post-radiation care, radiology, X-ray, that kind of stuff. We have a CLC, which is our community living center, and that's at Leeds, and that's where it's our long-term care facility where we have currently 24 veterans who live on our campus in the CLC and receive their long-term care there. We have various home-based primary care services that are offered at the different clinics where the primary care team goes out into the veterans' homes and provides home-based care, the nurses, the social workers, including hospice. We have smoking cessation and urology. All of those things would be considered under specialty care. We also have various social programs at the VA, including caregiver support, homeless veteran care, which includes HUD-VASH, transitional and supportive housing, LGBTQ plus care, minority veteran care programs, patient advocates and patient experience office. We have a transitional care team, which is for returning service members, and that helps with the transition from the military to the VA, and social work. We have telehealth services. We have both rehab and employment programs. So at our facility in Leeds, we have our voc rehab office, and they work with veterans who have voc rehab. And then we also have a CWT program on campus, which is compensated work therapy, where veterans who are a part of the CWT program, they work and receive a tax-free stipend for their work doing real jobs around the hospital, and to transition them back into the community to fill gaps in resumes and for them to be able to have skills and work skills, so that it makes it easier for them to transition back out into work in the community. And the VA is moving into a whole health model nationally. So there's a more focus on whole health programs, spiritual care, mental, emotional support care, other than just normal pharmaceutical intervention. And then we have mental health at our facility. Our facility in Leeds is mostly a mental health facility, a lot of outpatient care there and some inpatient services. The inpatient services are mental health inpatient services, and we have addictions and substance use care, mental health care, PTSD care. We have a PTSD inpatient program. It's 5 or 6 weeks, and they have their own ward. They're in Building 9. That's Ward 9. And then psychiatry and suicide prevention. So we have 3 or 4. Technically, we have 5 inpatient programs. We have our CLC, which is our long-term care program, which is where we have our geriatric veterans who live into a nursing home. It's long-term extended care. Then we have 4 Upper, which transitioned from an inpatient program to a residential treatment program where veterans come and they enter the program, and it's this 5 to 6 week program where they go to groups and get their services there. And then we have 4 Lower, which is a acute psychiatric program. It's a locked ward. There's detox. There's acute psychiatry that happens there. We get veterans who come in who are in crisis or who really need care, and then they usually go into 4 Lower, and they get the care they need in 4 Lower, and they transition from 4 Lower to 4 Upper into the other program, and then they transition from 4 Upper back out into the community. And then we have our PTSD ward, Ward 9, which is like a 5-6 week cohort where veterans from all over the country come for PTSD treatment. And then we also have our Cherry Street program, which is an off-campus program that's still technically inpatient, where veterans have access and they live in a house together. There's 4 units of 4, so 16 veterans who live off campus but still are technically inpatients, and they get their treatment and have a social worker, and they it's a sober house program as well. They're drug tested, and they have a curfew, but they also work in the community, and it's another transition to then become fully integrated out in the community as well. And a lot of those veterans who are in Cherry Street are also veterans who are in our CWT program, but not all the veterans in the CWT program are from Cherry Street. There's also outpatient veterans that are a part of the CWT program as well. And then my office, we are the Center for Development and Civic Engagement, and we handle philanthropic engagement, voluntary service, and strategic partnerships. And some of the programs that we have are, we have a horticultural program, we have a volunteer transportation network, where Chuck is a volunteer there, where we have volunteers that drive vehicles that were donated to our facility by the DAV with the mission of picking up veterans who don't have access to transportation from their homes and bringing them to their medical appointments and their benefits appointments. And we have Qigong. Angelique wants to do dance. We still got to figure that out. It's hard right now because volunteers aren't still allowed on the inpatient wards. So we really have to figure out a program that would be more geared towards outpatients, and then have them sign up and then do maybe a series that way. And we have Qigong. We just started a food pantry. So we have a veterans food pantry. That's where I was before this. That's why I was a little late. On every Tuesday, I go down to Springfield to Mass Military Sport Foundation, and I pick up food from them. And I bring the food back up, and then we have a food pantry that's open from 9 to 3 on Wednesdays for all veterans to come to be able to subsidize some food. It's a menu-based pantry, so they come in. I have a menu of different offerings. The veteran fills out what they would want. The volunteers fill the bags, and then the veterans go. And then it's not meant to be a one-stop shop. It's meant to help subsidize and really kind of attack veteran food insecurity, which we have seen, especially now since coronavirus, and as we move forward into 2023 with the prices of gas and the prices of food. Veteran food insecurity is a really big issue nationally, and that's a way that our office is trying to tackle that as well. We are starting a precedence now of getting volunteers back on the boards through our pet therapy program. So we have therapy dogs that come twice a week. We have 2 different dogs. One comes on Tuesday, a little French bulldog named Liam, and he goes and visits our veterans on our CLC. And then we have a golden retriever. Her name's Paprika, and then she comes on Thursdays or Fridays, and she visits our veterans on 4 lower, 4 upper, and then she comes to the rec hall and visits them in the gym, which we have a gym for the veterans to work out in. We're really pushing to try to have it be open more to outpatients. Currently, it is mostly for inpatients, and then we also have a new program there. It's called GeroFit, and it's ran by the physical therapy department. And GeroFit is a geriatric fitness program, and it's targeted to veterans who are 65 and up to encourage them to have physical fitness. So they come in, they have a cardiovascular exercise class that's done in the rec hall auditorium, and then afterwards they go to the weight room and then they lift weights, and all that's monitored by the physical therapists, and they track their progress, and it's supposed to encourage physical health and cognitive health amongst our aging population of veterans. And they have a FitVet program, which is for veterans that are under 65 that hasn't really taken off as well as the GeroFit program is. There's so many people now that they have to have a second class, and they also have like 30 veterans every Monday, Wednesday, and Friday tune in from home, and they do a virtual class. They do the cardiovascular class virtually, and then the veterans who are in person then go down to the weight room afterwards, and then they lift weights in the weight room. And we also have a creative arts therapy program as well with a creative arts therapist that's open to both inpatients and outpatients. And the creative arts studio is in the basement of my building, which is the rec hall building, building 11.
Wow, that's a lot.
Yeah.
Really?
Yeah, I can answer any questions that pertain to the drivers, volunteer drivers up there. The only problem we have, one thing we have a problem with, we cannot take anybody who's wheelchair bound. They have paid drivers up there who will do
Yeah,
that.
that is another service that the VA has. It's the Veterans Transportation Service, where they pick up veterans who are wheelchair bound and bring them to their appointments as well. But what our program does is just, because the volunteers aren't allowed to touch the patients or physically help the patients, it's mostly geared to people who don't have access to transportation and are still ambulatory. If they have a walker, we'll take them with a walker. If they have a cane, we'll take them with a cane, but we have no way of transporting veterans who are wheelchair bound. That is for the VTS program.
I've been a driver up there for almost 5 years. I have a tendency to take care of my hometown first. I live in Easthampton. I usually grab the people from Easthampton and Southampton. I've taken quite a few people from town to their appointments. It's something I enjoy doing. And I recently took over being lead driver on the program.
Thank you.
Yeah. I'm local. Nancy and I live together. We're married. Well, in our 70s, she didn't change her name.
Past commander of the
That's
American
commander of the
Legion
post,
224 in town.
224. And I am the president of the board for the bar. So I'm not going anyplace quick.
I love your transportation services. I've referred people from town over to you guys. It's been flawless every time. So thank you for what you do.
Gets me out of the house.
Yeah.
Gets me.
Get you.
I like driving.
To the tune of over 5,000 volunteer hours a year, our driver volunteers donate their time every
That's
year.
wonderful.
Over 160,000 miles driven last year. Hundreds.
It's not only to Leeds.
Not only to Leeds, no, and it's not only to the CBOC as well. If the veterans if they have appointments out into the community because of the Mission Act, we pick up the veterans and bring them to their appointments in the community as well, not just the hospital and the outpatient.
Some of the local hospitals I've been to CDH.
Yep.
I've been to Holyoke Medical Center. I've been to,
They say.
I know you guys bring people to Springfield. Because those are my usual sending people over there.
So, we'd like a 2-week lead time. Emergency, we can get done in about a week, because I have to have time to find a driver.
Yeah, and that's because at the end of the day, they're all volunteers, and if the calls come in, we're inundated, then if they have lives as well, they're dedicating their time out of the goodness of their heart to serve their fellow veterans. So we do ask that if you are booking a ride, try to give us as much notice as possible, and if we can't take it, then we can't take it.
You have a question? We have a couple.
For the food pantry on Wednesdays, now are all your volunteers veterans necessarily, or is it,
No,
Okay.
you don't need to be a veteran to be a volunteer.
okay.
The VA, we do love the idea and the veteran serving veteran thing, but
Yeah.
anybody who wants to serve veterans, anybody can be a volunteer.
Because that Riverside is definitely looking for more opportunities to reach out and offer ourselves to the communities, specifically during daytime hours.
Oh, yeah, and that
So
would be something that
great.
we'd be looking for as
That would
well,
be great,
because
yeah.
most of the volunteerism would be during the daytime hours.
Yeah,
Great.
yeah, so that's great. I'll have to get you. on that.
Yes, yeah.
Do you have a card?
I was running from the other place. I gotta check my wallet and see if I have my card with me. If not, I can just write
Would
down.
you volunteer?
Are there
Stuff
any
like
more
that, yeah.
questions?
I would
I
like to
have
look
a
at that.
question.
Yeah, I know you would.
I would.
Do you find the vets who come to you, do you find that they're from a specific time or specific?
As a driver, we have had World War II vets, Korean vets, Vietnam vets, Desert Storm, Shield, and the whole spectrum.
Yes. Yes, and the majority of the people who use the services in Leeds currently are people who live in the surrounding communities, Easthampton, Southampton, Northampton, the hill towns, and west. A lot of the people who are around the Springfield area get their primary care services in Springfield, and they'll come up to Leeds for their specialty care.
Yeah, I was just curious if like one group stood out.
The most prevalent group that we have currently right now is the Vietnam era veteran. We are seeing an influx of post 9/11 OEF, OIF, OND veterans, and now even more newer veterans from the Afghanistan time of conflict. And so those numbers are increasing. Those veterans, however, are more geographically located towards Springfield and towards Worcester and Boston, and less in terms of the hill towns. The majority of the veterans who live in the hill towns and in this area are more of the Vietnam era veterans that we see, but we do see the whole spectrum of veterans. Well, unfortunately, less and less World War II veterans, but we do still see them time and time again. But
Yeah, I would think most of your World War II would be soldiers.
yeah, oh, and they're.
That's different services.
Yeah, and
Different service.
You have
soldiers'
to
home is
apply
the
for
state,
that.
yes.
Very
So
different.
the soldiers' home is operated by the state.
Like that, I
where-
know, but I still think World War II, they'd be up there in age.
Yeah, oh, yeah, and
Are there other questions?
Just for
Yeah.
clarification, I am a Vietnam era vet.
Okay.
yes,
My mom used to work at Bay Hospital, and my nephew, Mikey, was in the army, and he was there for a couple of weeks there. And he went to bed with it. He went in the army, so.
Yeah.
He got it there, he went there, so.
yeah, we're gonna be 100 years old next year.
See the question?
Do you have a question, Bob?
Yeah, rear. Rear drop plate.
At least.
Leeds, yep,
Yeah,
And my mom used to work.
yep, right by Look Park,
and I.
right off of Route 9.
Yeah.
My mom used to work at Bay Hospital. so,
Interesting.
Do we have any other questions? No? Well, thank you guys.
And
Love it. Thank you so much.
You want to contact me, go through Nancy, or else, and she can give you my phone number.
All right.
So if somebody wants services, like, are they supposed to call a specific number?
So, if you want services, you have to enroll, and so you have to go, you can call the number and have them forward you to enrollment and eligibility, or if you come in to enroll, first you have to see what services you're eligible for, and all that's depending on your income, your service connection, and, your age, and all those other demographics, and that's done through the enrollment and eligibility office, and that's done in the customer care suite, which is in the basement of building 1. And that's the same area where the community care billing is, the lease information, the agent cashier, and beneficiary travel.
And my direct line up there is 413-582-3078. If nobody's in the office, we do have an answering machine. I mean, I took a run in this morning to check any of the calls, and most of them were hang-ups.
Yeah.
But I usually try to get in there between 8 and 8:30 every morning to see what's going on and assign rides. Assign right to the drivers to make sure we're covered.
Okay.
Yep, and all the prompts in the message are telling you what pertinent information you need to leave in order we can make sure that we have all the information we need in order to ensure that we can get you a ride.
Great. Thank you guys.
Thank you.
Appreciate it.
No
Thank you so
problem.
much.
Thank you.
Yeah, no problem. All right. Thank you so much. Thank you for having us.
Of course.
And it was a pleasure meeting you all, and have a wonderful rest of your day.
Bye, guys.
Thank you.
Enjoy.
So we were supposed to have a second speaker from
Thank you.
the DTA, but they couldn't make it. So they'll come another month. That's cash assistance, food stamps, all that type of thing. So, I feel like the rest of the meeting, we have a lot of updates. Let's see, so the snow removal ordinance meeting. Did you want to say something about talking to Brad?
Yeah, so me and Stan met with, excuse me, with City Councilor Brad Riley about the snow clearing issue. And he listened politely. He didn't defend the status quo super vigorously, which was nice. Me and Stan obviously don't have the same opinion on the issue, and I'm sure, you know, other people here don't have the same opinion on the issue. So we didn't exactly have a united message about it, but I felt like we both expressed our viewpoint, you know, well, and he listened to it, and he seemed to have some, some sympathy for it. And I don't know how he will, where he'll take that, but at least he listened and seemed to take us seriously.
And so, I mean, is this something that we should have another meeting with him about? Like, or did you just feel like you were voicing your opinion and then?
I just felt like we were trying to kind of explain our positions on the issue, right? What we thought the problem was. And I don't know how we should follow up. Maybe we need to talk about that. To talk about how we're gonna follow up.
Planted the seed.
Yeah.
And it's
Yeah, and as you know, like, I think the system it's fundamentally flawed. It's it's designed to fail. It's a completely arbitrary kind of carve out that snow clearing on sidewalks has from all other maintenance in the city. And we are.
And how many cards? Thank you.
I almost forgot.
Thank you. No, I would have gotten.
Right, and it's based on this bias toward, the status quo and toward the dependence on motor vehicles. And, Stan is kind of, I don't want to speak for him, but, my understanding of his position is that, he basically thinks, right, we just really need to enforce the current ordinance, more strictly.
With police.
Yeah, with the police.
Do you have a question, Joe?
I lose papers, so I take pictures. Let's see. It just seems to me that like we maybe before following up, would it make sense for us as a committee, or is it doable for us as a committee to adopt a formal set of recommendations? Or, or just.
Yes, I mean, we had a big meeting.
Yeah.
And Liz was there.
Yeah.
So.
We've never had a meeting about, like, to establish like what we as a commission think about this issue, right?
That would be another.
Yeah, do we?
Subcommittee.
Yeah, I mean, would it make sense for, just for us to present a list of like 5 action points that we want city councilors to act on, or something like that? Or
yes.
Just.
Yep.
Yeah. And is it within our purview to do that, I guess?
Yes. Yes, we can, because we can.
Yeah.
We can always ask anything we want about an ordinance, about changing it, or.
Yeah, I mean, I think that's kind of what we're here for, right? Is to advise the city council, so we can, if we can agree on what advice to give them, then yeah, certainly we we can formally offer that advice.
All right, well, we would have to, I guess we could make a different subcommittee. And if you can't make it to the meeting, you can just email me what you want me to know.
Yeah,
Sound okay?
and you know, at the last meeting,
Yeah.
sorry. At the last meeting, we tried to kind of shoehorn in a conversation about this, like after 11 o'clock. And I said, well, maybe we should like put this on the agenda for a future meeting. So we still
Yeah,
can do
When
that.
we do that, put it on the agenda for future meetings.
so it could have been on the agenda
Yeah.
we're talking about it right now, which
Right.
means we
Yeah.
could continue to talk about it if we wanted to go into depth right now.
Do we have time again?
Go ahead. There's other things, we're just doing updates, so if you want to, we can.
So Eli, it sounds like you were saying you think Stan's okay with the current ordinance, just would like it enforced. What is your concern? It sounds like you want more than that.
Yeah,
What
so,
he wants, they were very clear they're not gonna ever give,
Oh,
right?
right, but
Yes.
that doesn't mean we can't have us negotiate from a strong
Yeah.
kind of starting point.
Right.
Yeah, but basically, yeah, I think the current policy can't be enforced effectively, right? And, right, that because the roadways and the sidewalks form a network, and the network needs to be connected in order for it to function. And so if any piece of it is disconnected, then the network as a whole fails. So you can't have a system where there's always like some piece of the network that is impassable, and then we have to spend time, getting someone to reconnect it, right? And that's not how we deal with the roadways, right? The roadways, we recognize that importance, and we treat the whole network, and we make sure it's clear even before it stopped snowing, right? There are, whenever it snows, there constantly, I might see like 5 or 6 trucks go by like in a few minutes, even while it's still snowing. And with the sidewalks, we say, well, maybe in 12 hours, then we'll think about having each individual, right, clear it, but we're going to give them, obviously we're going to give them a lot of leeway because they have a lot of other responsibilities in their lives, and like we don't take responsibility for it as a city, and see the importance of keeping it connected as a network.
Yeah.
Good.
To piggyback on Eli, so if I've heard you articulate this a bunch, and it makes sense to me. If you are walking down a sidewalk and there is 2 houses out of 20 that didn't do a good job on their sidewalk, so that's a 90% compliance rate, which is fairly good, but those 2 houses out of 20 could make the whole sidewalk impassable for people, or someone could just do a half-hearted job, do it once at the beginning. Oh, all the ice melts on it. Well, they're not de-icing. Now that sidewalk is more dangerous than it was if they had done nothing at all. No, number 3, I used to run into this when I was living on Briggs a lot. The sidewalks would be shoveled, and then you'd have the plows just dumping it on the edge of the sidewalk, so you couldn't cross the street without hopping a snowbank. And it's just, and that's not even fair to homeowners if municipals are just that, egregious with their, lack of care for mobility needs and
Right.
pedestrians as like legitimately people that, as legitimate commuters. It's like, yeah.
Yeah, and I remember we also had an earlier meeting with Sergeant Alexander, right, about how they respond to complaints. And, he was saying, well, we only get like a few complaints, so it's not that big a deal, right? But yeah, but like complaints aren't the problem, right? It's and complaints don't reflect how much of a problem is, right? Because people know complaining is futile, right? By the time you have something to complain about, it's already, the system already failed.
Yeah.
And most people are not gonna bother because it's not gonna matter.
Right.
The times I've had to actually go to the police about something like a mobility or ADA issue, crickets, no response. I was across the street. There was someone, I was trying to cross the street with like a group of 4 clients once. There was this huge truck parked over the curb cut. All they would have had could have taken them 30 seconds to get over there. And when I spoke nicely, the driver, he was just and they just didn't. And it's, so am I ever gonna, let alone that I might find a way to get tear gassed in that situation. But would I ever call the cops about anything again? It's like,
So I think that, we only have this room for limited time, and I think it's probably gonna take an hour or more to come up with these points, right?
Yeah.
So we're gonna have to do a subcommittee because the room is just not available after our meeting to stay longer. So are there people that how would you guys like me to do that? Do you want to be on a subcommittee? Do you want to just email me stuff? Like, do you have I know a lot of you have other things, so you can't really be coming to subcommittee meetings all the time.
About emailing suggestions, before the next meeting. Hopefully.
Yeah, so the only thing we just have to be careful, is like we can't have a discussion. We can't go back and forth, yeah.
No. But if you have an idea of something like I do,
Yeah.
take them, if they're naysayers, take them out there with a walker or a wheelchair or a scooter in the problem areas.
Right.
And let them see what these people have to deal with.
Right. Who would take them out?
One of us.
One of us.
I got 200.
I have a hard time getting people to come to one meeting. I don't know if we could do that, but, okay, so Eli and I will figure out, we'll do a little poll about when you guys are available, and if you can't make it, not upset, just email me, whatever you want us to know.
Yeah.
Sound good?
Also, if we ever have a heavy snow this year and you find a place that's not maintained well, it'd be good for us to get footage of it. For,
Good point.
yeah, for the PSA thing.
Okay, so, yeah, you want to.
Would it make sense for us to for issues, would it make sense for us to devote you've been doing such a great job getting speakers in here and it's so valuable.
Mhm.
Would it make sense for us to earmark one meeting a quarter or something like that where we figure out a hot button issue like this and really that's our discussion for the time, and that can be maybe even if we couldn't be on the committee, that could be maybe a launching point for committees to.
Yeah, that's good. And then because it's always rushed, right? When something like this comes up, it'd be good if we could devote a solid block.
Well, part of it is that part of what happens on my end is nobody says anything until a couple days before the meeting that we wanna. So when I'm creating the agenda, it has to be in a certain number of days before. So if people don't say things, then I have to find things to
Of
do
course,
for
of
the meeting.
course. So,
Yeah.
so maybe for stuff like, if we're finding ourselves in this where we're in a conversation and wow, everybody has a lot to say, maybe you could just make a list of those things, parking lot that, and then when you're finding that we have an open spot
Yeah.
or something like that, that's when you could, that might be.
Yeah.
I was just gonna say, do you have a speaker already lined up for March?
I do, but, so there's the other problem is the speaker's supposed to take 10 minutes. And sometimes they run over and then sometimes you guys have a bunch of questions. So I only allot 15 minutes and like today it went to almost 40 minutes.
Wow.
And so, I can be more assertive and cut you guys off if you like.
I was just thinking of what Jeff said, of maybe once a quarter.
Yeah.
Having
Yeah.
no speaker.
Yeah.
That's totally fine, yeah.
Earmark snow removal and other things, and we spin
Yeah.
the meeting on that.
Yeah, 'cause I don't even understand how what the process would be, like if we came up with some really great ideas, what do we present them to city council?
Yes, so let me just say it also involves people coming to the meeting, because I did do that in the past, and then there was one meeting where like 3 of you weren't here, so if we earmark that meeting and then you guys don't show up, I'm not saying like your fault for not showing up, like you have reasons,
But
it's
if you
just,
know in
then you
advance.
miss it, and then the next time you guys are like wanting to talk about stuff that maybe we had just talked about last time, so it's a fine balance, that's all I'm saying.
Yeah.
Totally, yes.
Also, this probably isn't even an option, but for something like this, it would be really good to have kind of an experienced, like, neutral facilitator help us with it. I don't know, that's probably not.
So that sounds great, but again, that's a subcommittee thing.
I know, but I
Right.
just thought I'd bring it up, so, like, just in case that there was a possibility.
Yeah, we can look into one. Do you know places to look in, like that? No, okay.
Why don't we try first, maybe having a meeting dedicated to it and sorting it out, and see how that goes. Does that sound?
Yes, you can totally do that. I'm just saying I did do that in the past. I know you guys didn't notice, and then we didn't have a speaker one of the months because they canceled.
Okay.
Okay. And so it just we didn't get much time. So that we ended up, closing the meeting early that particular day, like maybe 15 minutes early. So it was a while ago, but okay. How many minutes? We only have like 5 minutes left, so. I'll just tell you guys, I have a meeting with the mayor today to talk about the PTSD panel. And I'm actually doing a dance event, but it's strictly for people that, well, let me take that back. I got a lot of complaints of like, oh, how come there aren't dance events for people that are compromised, right? So masks and all that. So I was putting on an event by myself. Then I wrote to the mayor and said, is this something that I could ask like the Commission on Disability to like sponsor? And she was like, absolutely. So the town's gonna sponsor this event that I'm doing. She gave me the language, and so I can send it to you. It's just like a 2-hour, it's at the Blue Room, and it's like I don't know if anybody will come. I could be standing there by myself. But you have to be wearing the appropriate masks and, have your shots, unless you have like your medical reasons why you can't, all that type of stuff. So
When is it?
it's March 11th. So we will have another meeting prior to that happening. So I'm talking to the mayor after this about both of those things. And she wanted to know if we wanted snacks. She's like, or should there be refreshments? I wasn't even thinking about that. She's all over the snacks.
Right.
If she's willing, yes.
Right.
Yes.
Yeah.
What is the PTSD camp? What is
That's that.
So that is, I know you wanted to talk to me privately about it, yeah, so.
There was more just to ask that question. What is this?
Yeah, I think you weren't here at the meeting where I talked about it a little bit.
Okay.
So it's having, it's something that I started several years ago, and then after I put it together, it got shut down after I worked on it for a year. So it's having different people from, that have different forms of PTSD, like from different areas, because everybody thinks it's a veteran thing, and then it's a veteran that have been to war thing, and like, that's the end of it. And like, there's so many other folks that have PTSD, so my plan is to have speakers, and then also the equivalent, like mental health provider that treats that type.
Right.
And like, I'm hoping people will come and like, I don't know, learn stuff about it, or the whole point is to take the stigma away from it, because people don't like to talk about PTSD. There's a lot of shame around it, so. So that'll be like a longer term project that if you guys want to help on, you totally can, no pressure. I'm looking for speakers right now. I've reached out to the community, try to get speakers from Easthampton more so than looking elsewhere, but first.
Yeah.
So.
I'd be happy to help with like any kind of logistic type things.
Thank you.
Yeah. How often would the panel meet?
Just one, just a one.
Oh, one time.
So is it
Yeah.
like a city presentation?
Yeah, it's like a workshop. type
Okay.
of- Yeah,
And when, kind of roughly, when are you thinking this happening?
maybe like 6 months from now, since we only have 1 hour meetings, right? We can't get a lot done. Yeah, so,
And is that these meetings, or you're having another?
no, you guys, because whatever I do, I gotta bring back to you guys and make sure you're okay with it, right? I can't be just winging stuff behind the scenes without talking to you guys.
We're sponsoring it.
Right, gotcha.
Yeah, yes, thank you, yeah. So we have to see when the room is available, see when all these, it's just, a lot of logistics, so. I like to say I could get it done a month from now, because I could, but that doesn't mean the city could get it, right? So just to be realistic. If there's not any more questions about that, did we have like one more? No, we had 2 more things. If you have to go.
Enjoy summer meeting at 11.
Thank you for
Sorry.
coming.
Thank you.
Nice to see everybody. So if people have time, there's 2 more things to chat about. One is that we've been having off and on some meetings with the other committee chairs. So like me and Eli, I try to set up like a meeting once a month with other committee chairs, so we can know what they do and they can know what we do and all of that. And so at this point, we've had 2 meetings, and you guys can come. Like it's designed for the chair, but that's just because if we invited everybody, it would have to be, there's that whole meeting laws, like it would have to be posted in the minutes and the this and that.
3 meetings, that's okay.
Just kidding.
Oh,
We
okay.
only had, we wanted other ones.
Oh.
Yeah, we've only had, yeah. And so that was nice. We've had different chairs of different places sort of come and you know, it's hard to find a time for all of the chairs. Yeah.
Who have you met with already?
Oh,
Yeah.
what was the
There's some people
electrical?
There's some people from the
Right.
the Community Relations Commission.
Right.
There was the guy from the, I don't
Elec-
remember what it was called, but yeah, he was looking at some kind of municipal like electric plan. There was, I'm blanking on the other people.
Yeah, because that was a couple months ago, the other one. So there were a bunch of people that were supposed to come to this one, and right when the meeting started, the power went out in Easthampton. It was great. So we all thought it was like our own computer, and it was the power that went out. So then some people didn't come back, so they didn't actually get to be part of the meeting. And then the meeting where our first meeting, that was a while ago. Like, I don't remember who came off the top of my head. I took notes, but yeah, so I can let you guys know about it if you want to come. So the idea is right, so that we can, it just seems like a big mystery. We don't know what committees are out there. They don't know we're here. Like, I don't know. we just gotta have better communication and transparency. Like transparency is really important to me. Did you have a question? No? Okay. So, and the only other thing I think that is on here, is if you wanna, do you wanna talk about the survey subcommittee for a sec?
Sure. So the survey subcommittee has been meeting. We made a little progress on kind of how to report on the survey from 2021. Right now, the ball is kind of in my court. There's I'm supposed to be working on outlining how it's going to go. But then we also started talking about like what would we do differently in a future survey. And so that's, yeah. And so I feel like that's good. We might be able to do another survey maybe next year.
So if you guys have ideas for the survey, you can send them to Eli or me.
Let's see.
If there's stuff you feel like we should cover, please send it over. And yeah, so is there, I mean, those are all the things that we did in between. This month, we did a lot in between meetings. We had a lot of extra meetings. So is there anything you guys want to say? Because
and I should point out that the survey subcommittee right now is me, Angelique, Stan, and Molly.
And our next meeting is
our next meeting is
Next
Friday, at 2.
That's
Not
that's
this
right.
one, but the following one.
Yeah. Oh, yeah.
The 17th.
Yes.
Yes. And then just for the record, our next monthly meeting is March 7th, right?
Mhm.
What's so inside Tuesday?
Yes.
Yeah, I know.
Yeah.
All our meetings are on a Tuesday.
You guys have to be able, you know what they.
You still want me to speak?
Come to me
Well,
and you know.
February and March are exactly the same.
Right.
Wow.
Good job, Dave. It is the same, yeah, it's not, well, not, I want to.
Is there any like new business or anything that you guys want to bring up or comments? Because I know I just threw a lot at you about 20 different meetings we had.
I don't know if you're familiar, I know most of you, the Shriners in Westfield have
Yeah, we're not
a
talking.
free medical equipment program. You can donate to it, and anybody that needs walkers, hospital beds, anything like that, on Saturday mornings from 9 to noon in Westfield at their lodge. They're there to give out this equipment to anybody in it from all the area.
At their lodge, so not the hospital?
Huh?
You said at their lodge?
At the lodge, yeah.
I've never even heard of it. I only know the hospital.
You know that when you come off the rotary and you start going towards Big Y in Westfield? It's right on the left-hand side.
Okay.
I can get you the address for it.
Please.
But like I say, anybody that needs a scooter or whatever, they have a whole truck full of equipment there. What they do is they refurbish it and then they give it out to people. So,
Don't have it.
Huh?
People don't have it.
right. And also, if you hear of anybody that's trying to get rid of any canes, walkers, scooters, beds, commodes, anything like that, they can donate it free to them.
Right.
I think maybe we should have one of the guys from town that is big in this program, Don Carberry. Have him come in as a speaker.
Where is he from? Because we had the
He's from
council on
Easthampton.
aging person that takes the equipment, talk about it.
They don't really refurbish it. These guys spend a lot of time refurbishing the stuff.
They do have a gentleman come in,
Okay.
yes.
But like I say, you may want him for 10 minutes as a speaker sometime.
I don't get where he's from. You said
He's from Easthampton.
Right, but where,
Organization.
part
He's a
of,
Shriner.
He's
He's a
Oh, he's a
Shriner.
Shriner,
He's
okay.
involved with Pulaski Hall also and with
Yeah.
the Legion and whatnot, so.
okay.
It might be to have both of them because
Right,
through Council on Aging, you can also get the beds in there, but the beds are up at the jail. The jail houses the beds because we don't have the space.
Yeah, they have pickups and stuff. Anybody can go over there on Saturday mornings from 9 to noon. It's right in the back of the lodge.
Okay.
There's a truck there and you'll even see them working on some of the equipment that comes in.
So it's good for people to know that they
Yeah.
have both choices.
Okay.
If one doesn't have it, the other one
Right,
might.
right.
Okay, so next month Eli's gonna talk for a few minutes about his bike, safety riding
Yeah.
situation. I forgot the name of it.
Cycling savvy.
Thank you. And we have somebody from Community Action. And so before we pack up here, I just want to say, like, when we have a speaker, like, so one, I'm a little shy. So like, if somebody's speaking, like, I have a hard time interrupting them. It doesn't matter who it is, but like, I tell the speakers that they have 10 minutes. And usually what I hear from that is, oh my God, 10 minutes, that's such a long time. I don't know if I'll have enough. And then they come and then they talk and talk and talk. And then if you guys end up asking questions that are just like, that you could be asked privately that are not for the, like, then it, like, I'm just not really sure what to do. So it's my job to shut it down.
So.
But I'm just saying, that's what happened.
15 minutes, 10 for the speaker and 5.
That is what I tell them ahead of time.
Yeah,
But like,
if we maintain, if we.
Right.
Give a sign, tell them this is the sign you're getting
Yes.
to, and then there'd be no point with us. You can just say, okay, guys,
yeah, so
Don't
that's
be shy
my
with
flaw,
us.
that I don't like
Yeah.
to cut people off if they are talking.
but if we, let them.
Yeah.
We
And
also do get slowed down with the technical stuff like that.
Oh, today we really did.
Yeah.
And there was somebody else in the room before.
That's right,
Yes,
yeah, and I did say I could help with facilitating, but that was before, like, most of my energy was on this.
Absolutely.
Yeah,
You got a full-time job over there.
Yeah, we didn't get into the
Like, I
room
can
till
barely-
almost 10.
pay attention to the meeting, to what people are saying at all, like, because I'm focused on,
That's what I was worried
Yeah.
about, going hybrid. Like, I
Right.
wanted to go hybrid, but then having one of us have to man this is really difficult because it does take away from the meeting. So,
Well, maybe what would be helpful is when speaker actually is ready to start, so let's say, okay, if we look at the clock and say, all right, we're gonna do this till blah, blah, whatever.
Oh,
time.
I am. And then my anxiety goes through the roof because then they just keep going and I'm not sure. I'm like, oh, well, it sounds like they have a lot more to share. So then I don't want to.
I think it's good for them to know too, like, okay, so it's blah now, so
Yeah.
let's go till da-da-da. And
I
I'm
can
happy to
announce
help
it.
with that. I just need concrete stuff. I'm not
Yeah.
good with non-concrete.
Right. Can we ask speakers to, give us the bullets and have a handout? Like, I missed several of the stuff
He really.
that he was saying, because I'm trying to write it all down and then, okay,
Yeah,
but sometimes if they give us bullets
Right.
and then say, oh, we have a handout that, like, we've had a couple who have done that. They've given us bullets and they've given us a handout so we can read more.
Let me close the meeting real quick so then I can comment on that. Okay. So anybody, anything else to share or can we adjourn?
I got one more. But if the speaker comes in, and talk about what they talk about, we have to wait until if you have any questions, let the speaker talk first before you
Right.
ask the question.
Right. Yes. Thank you. Okay. So,
Motion to adjourn.
motion to.
all right, let me shut these off.
Second, aye.
Time to get a watch.
11.
Okay.
Time to get a watch, Jerry.
This government meeting is brought to you by Eastworks and our local cable subscribers.